irritation. You wouldn't really say that the skin is occluding the ear canal, it's just coating the surface of the ear canal. And the skin is slightly infected, you can tell by the colour. They had been using a few drops a day before. And because there's some dead skin coating the eardrum, it was also causing some hearing loss. So the eardrum wasn't as mobile as it normally would be with this dead skin there. Now, this patient has got a very narrow ear canal entrance and the cartilage is quite thick. So we've had to stretch the ear open. We do that by pulling the patient's pinna back on up. So the pinna is the external cartilage. So the satellite dish of your ear, I elevate that back on up to straighten and widen the ear canal. I then insert the endoscope, as you can see, and the endoscope acts almost like a door stop, which then opens up the ear. So I can just about there, you can see, insert my, I'm using a fine end at the moment. Previously I was using a full Zollner suction probe. So this skin, we sort of removed the posterior layer of dead skin. We're now on the anterior canal wall. And in a moment, you'll see me approach the eardrum very delicately to remove it off the eardrum. Because the patient has got a slight ear infection, the skin is slightly infected, there's a lot of humidity in the ear, and you may have noticed when I insert the iClearScope endoscope into the ear, at first there's a bit of condensation, a bit of fogging. However, that dissipates almost immediately after I put the suction probe in. If I just left the endoscope in there for a few more seconds, it would have naturally just dissipated. That's one of the benefits of an endoscope. So the endoscope itself, the rod lens system, so think about an endoscope like a telescope. You've got a series of lenses, rod lenses, sequentially adjacent to each other, which gives you the image. And then coating these rod lenses are a series of fibre optics, bundles of fibre optics. And this transfers light into the ear, and it also helps bring the image back. And the fibre optics, because they coat the entire length of the rod lens system of an endoscope, they add a slight bit of heat, and this heat then helps prevent fogging. So fogging happens when you've got moisture, humidity in this case an ear, and it naturally condenses against the coldest surface. So because the ear temperature is higher than the temperature of the lens of the endoscope, you get fogging on the lens of the endoscope. But with an endoscope, after a few seconds, the fibre optics, because they are sending light across the fibre optics, there's a slight bit of heat there, which helps evaporate the fogging. So we're just on the eardrum here. You can see this crusty layer of dead skin. We're just slowly peeling it off. You need a really, really steady hand here. We don't want to be causing any injury or making any contact with the bony part of the ear canal or the patient's eardrum. So you can see 3/4 of the patient's eardrum. It's just the superior anterior quadrant, and slowly but surely I managed to peel that off as well. And once at the end of this procedure, I'm going to again show you the pre-examination video so you can just compare what it was like before and after. Some people say, why wouldn't you just flush it out with water? Irrigation in the UK, or syringing as it was previously known, it's no longer used as much in the UK. I would say some clinics still do, but irrigation has inherent risks. It's not to say it's going to cause every single person that undergoes a treatment an ear infection, but one of the biggest risks of ear irrigation or syringing is developing an ear infection, because water, if you've been watching my videos, I'm trying to educate the viewers just to promote your own ear health. Do not get water in your ear. I have said it a few times, and I will continue saying it. It's more for your own benefit, because water is really, really bad for the ears, guys. Just say we've got 100 people and every one of those 100 people get water in their ear regularly. The majority of these people will be fine, but just say 5% of those people will then develop swimmer's ear, and you can't predict which 5 of those 100 will develop swimmer's ear. And once you've got swimmer's ear, it can cause no end of problems. You can get stenosis and narrowing of the ear canal, chronic ear infections, and even with constant and regular use of antibiotics or antiviral or antifungal treatment in the ear, it can be hard to shift. So just don't risk it. Water can cause an infection in the ear. It's called swimmer's ear. It kind of washes away the acidity as well. So the acidity helps to keep or inhibit, should I say, bacterial growth in the ear. So irrigation, yes, that's not going to peel skin. The skin is embedded. We do have to go through the the mechanical motion of peeling. Skin is just going to flush water. If it's excessive amount of pressure, when you syringe or irrigate it, you run the risk of perforating the eardrum. Some patients have a perforation already, or grommets, or a ventilation tube or a T-tube. Therefore, you can't use irrigation or syringing in those circumstances, because the water can enter the middle ear through the grommet or perforation, which then can cause quite a severe middle ear infection. It can lead to meningitis or brain abscess. So worst case scenario is it can be life-threatening if you get middle ear infection, and it's not treated. So many people get ear infections in the middle ear, but there has been instances where it has got quite serious. So just don't take the risk, guys. So if you go swimming regularly, when you shower, just avoid water in your ear. So ways you can avoid water in your ear: you can simply just get some cotton wool and some Vaseline and create a little plug at the entrance. Don't push the cotton wool in too deep, because you're going to have to remove this cotton wool, and if you do have a bit of wax, you may push it further in. You can get custom swim molds. So a cast is taken of your ear, and a silicone mold, hypoallergenic material is used to do that. You can get over-the-counter swim plugs as well, so foam inserts and silicone inserts. There's also some sprays out there. In the UK, we've got something called Earroll Swim. So it's a combination of olive oil, which is hydrophobic, so it provides a waterproof coating of the ear canal. So this is the pre-procedure video, should I say. And again, I'm going to play you the post-procedure video, so you can just make a comparison. So yeah, so this Earroll Swim, and it also says tea tree. So tea tree has some antimicrobial properties. So if you do get some bacteria that's left behind in your ear following swimming or bathing or showering, the tea tree can help kill that bacteria or inhibit its growth. You can get a swim headband as well. So these headbands, they're not as effective, I don't think, but they just wrap around, or not as effective as a swim mold. They're going to be more effective than the Earroll Swim, because obviously that you still are allowing water in. A swim headband, it's like a headband that goes over your ears, trying to stop water entering. So that's not going to be as effective as a custom-made swim mold, for example, but it's better than nothing. So do take good care of your ears. Never put anything smaller than your elbow in your ear, guys. That's something else I always preach to my patients. So don't poke in your ears, basically. Nothing smaller than your elbow in your ear. It's an old granny's tale. Don't get water in there. If you want, you can use some kind of olive oil spray, I recommend, but olive oil spray that's meant for the ear, guys, not home olive oil. You can sometimes develop an infection with that, because it's not completely sterilised or refined for safe use in the ear. So you get the stuff over the counter that's meant for your ear. I hope you enjoyed that video, guys. Sorry for going on a bit. I just wanted to give you some good pointers and tips for ear health. So yeah, I think I've mentioned it, but I'm going to say it again: no Q-tips, no cotton buds, guys. Please don't. If you trim the hairs on your tragus or concha bowl, so basically any hairs on the outer part of your ear, I know some people like trimming them, especially men like myself, when we reach a certain age. That's fine, but just put a bit of cotton wool just at the entrance, just to seal the entrance, not too deep in, just to block the entrance, and then trim, so you avoid these hairs going into your ear. These hairs can cause a matting of earwax, so it prevents natural migration. A better